Yo, what's going on, everybody? Not sure if you can actually see this. Let me turn that off real quick. But yeah, actually, my eye is red. My vision is pretty good. I don't know if you guys can actually see this or not, but actually, I looked this up online. I made a Instagram live. You can go check me out on Instagram, mikecee digitalpreneur. And actually, I can put it down below in the comments. But my eye actually Saturday. It's probably been about a week or so now. Actually, it's Friday now, so it's been about 6 days or so, and my eye is still red. I listened to a couple of people. They actually told me to put eye drops in there, actually clear eyes eye drops, which is kind of interesting because actually I used to make that. I actually used to test it. But anyway, yeah, if you can see my eyes actually red, I don't know if you can actually, let me zoom out a little bit. Look to the side, look to the left, the right. And it's actually red in my left eye. I had another one of these back in November. I looked it up. It's called subconjunctival hemorrhage. I think I said that right. What is it? Sub Subconjunctival hemorrhage. No, let me look it up. I gotta look it up again. I actually forgot what it is. Let me exit out of here. What is it called? Let me see. I'm gonna close that down real quick. I got my computer here. Yeah, that's it. Subconjunctival hemorrhage. And they said it could be caused from anything. It can be caused from actually um, stress on the eye. They said it could be caused from straining. Obviously, if somebody hits you in your eye, and some people actually told me that it could be caused from just eating a lot of pork, which I recently just started eating pork. Actually, I started eating pork in November, like I said. Actually, no, it was I started eating pork and I know I'm not looking at the camera right now, guys, but I just want you to see my eye. But I started eating pork again, actually in September, and now my eyes are still kind of messed up. It actually happened again, which obviously now it is February, so it's been what, November, December, January, February, so about 3 months. I've actually had another issue with this, but actually it said it's not a big deal. It said it's minor. It's a minor issue. It said it's happened to several people, and actually it said it happens randomly to different people, and it's really not a big deal unless you have a recurring issue, which mine could technically be a recurring issue because this isn't like the first time that I had it, and then obviously yeah, I had it in November, but I had it probably about 3 or 4 years ago as well. But I was eating pork then as well, which they said it also could be caused from high blood pressure, but my blood pressure is fine. I check it pretty often, my blood pressure, and everything else is fine. And they said if you do have vision issues, then you need to make an appointment with your optometrist or ophthalmologist, whichever one it is. Um, yeah, let me see exactly who is it. Let me see. But yeah, anyway, and then actually they had a picture of it on the doctors. You can look at it on YouTube. Obviously, YouTube teaches you a lot of stuff. It says there's a broken vessel in your eye serious, and most of the time, like they said, it's not. But if you have any pain or any issues like that, loss of vision, then you need to go to your ophthalmologist, your eye doctor. So yeah, you guys, actually, it looks pretty interesting. It's kind of weird. Obviously, my eye. Everybody's looking at me like I'm a zombie. I woke up and said I actually was bit by a zombie, and or either actually I told some people that I just got back from China, and if they were going to ask me which part, I was going to say Wuhan, China. So obviously, I don't know if you guys know or not, but that's actually where the coronavirus is from. And it looks kind of weird. I know. Zooming in and out. I don't know. I really can't even see what this looks like. I'm going to go back and look at this video. But yeah, if you guys have any issue with your eyes, or if you've seen this before, or if you see it in the future, just know that it is not a big deal. And obviously, I spend a lot of time on the computer, and The eye doctor told me when I went to him, it's probably been about a year or so ago now, actually a little over a year, and he was saying that I was on the borderline with getting glasses. He said you can get them or you can't get them, which kind of means, my eyes are right there in that area. Obviously, I'm 41 years old and I'm getting older. And then pretty much I asked him the question, if I do wear glasses and if I start wearing glasses, I said, does that mean that my eyes are going to be dependent on glasses? And he did say yes. So, I mean, obviously, I don't necessarily want that because I'm only 41 years old. And I know people are different, but I can't stand to have anything over my eyes. And obviously, I used to work in a lab. We used to have to wear safety glasses, which they say there's no medicine in the safety glasses. When I say medicine, I mean there's no prescription or anything like that in the safety glasses. But I could tell the difference if I put the safety glasses on and then I pulled them off. There is obviously it's not the same as looking with your normal eyes. And I don't know if that is looking with your naked bare eyes. I don't know if that's the I don't know if that's the I don't know exactly what I was gonna say, but yeah. Anyway, this is you can see. I'll zoom in a little bit more, so you guys can see it. Which it was healing up, and then I messed around and put some eye drops in it just by listening to a few people, and it was the exact same eye drop. Said it's supposed to clear it up, but it seems like it's taking a little longer this time than it did the last time. Which the last time it took about a week or so, and I mean, like right now, within a week, I know it's only been 6 days, but even within a week, um, but it is clearing up. Even within the 6 day period before, it wasn't this much red. You can tell it's clearing up. Actually, it was a darker red, but I guess the situation is the blood has nowhere to go in your eye, so it's pretty. It has to go somewhere, and then somebody said they're going to have to drain it out and all this stuff, but that's really not necessary because the blood will just actually go away. It just has to, or as the guy said on the doctors, I don't know, it's the tall blonde guy, the tall one. Actually, it looks like they changed some of the people who were on the show. Didn't look like it was the same doctors on there. I don't know if those were guests or not, but I remember the older guy, he was still on there, and then the younger guy, tall Caucasian guy with the blonde hair, he was on there. He was the one talking about it, and he said your body has to absorb the blood. Um, the blood has to absorb back into your body, and so it takes a while because it's in your eye. It's pretty much just like a bruise on your eye. Obviously, if you have a bruise on your body, it'll the blood obviously absorb back into the body, but obviously it's not as bad as this. It's not as red. That's the tendency to be, I guess, the black and blue. That's what a bruise is. But instead of being black and blue in my eye, it actually shows up red because obviously it's white. The Your eye is white. So yeah, just to let you guys know, it is fine. And if you experience this, just wanted to shoot you guys some value just to let you know some of the things that can actually happen to you if you are entrepreneur using the internet. Like I said, I spent a lot of time, and I'm not saying this is what caused it, but this could have been an issue. I mean, it could have been a reason because I do kind of somewhat strain my eyes. Maybe it's about time for me to go back to the doctor. Obviously, your eyes can change um, within a year's time. So it's probably about time for me to go back to the eye doctor. Obviously, yeah, it's supposed to go every year, but yeah. So just to let you guys know, it could have been caused by, but I mean, there's a lot of variables in that, as far as what I'm saying, because obviously I started eating pork again, which I'll probably stop. I mean, as far as when I say pork, I mean, well, yeah, pretty much just a lot of pork chops, sausage, bacon, which I don't think bacon is, as bad, but the sausages and the pork chops are pretty interesting and really not that good for you. But like I said, everything else is fine with me. My blood pressure is fine. So I don't know. We'll see. So thank you guys for hopping on. And I might give an update as to how and when this actually goes away. But like I said, it's clearing up now. And I hope you guys have a good one. Take care.